Oh yes, once again I wanna teach you today about hyperglycemia and hypoglycemia. David7 Sans Theater at gmail.com. That's how you contact us. But that is our poster, our banner, David7 Sans Theater. Don't forget to like, share, and subscribe. You subscribe for more and better videos. Our videos are good. You just click here, more notifications, more videos, more better videos. Science is everywhere. So today I want us to discuss about hyper and hypoglycemia. These are abnormalities in the norm of glucose level in blood. Okay, we said it should be around 70 to 110. So when it departs or diverts from that, then that is an abnormality. Hyperglycemia. When you when there is insulin deficiency, yes, glucose uptake of tissues reduces. You get? How is it caused? When there is insulin deficiency, uptake of glucose by tissues reduces. That is one. Two, protein metabolism increases. Plasma amino acids increase and gluconeogenesis increases when there is insulin deficiency. Yes, but the increase in protein catabolism will cause muscle wasting. Okay. Also, in insulin deficiency, there is glycogenolysis, right? Insulin deficiency is the diabetes mellitus. So there is glycogenolysis, which increases, breakdown of glycogen increases, and production of glucose increases. All these three, they will increase the blood glucose, causing hyperglycemia. In addition, muscles will be wasted and lipolysis occurs, so plasma-free fatty acids increase. Lipolysis is stimulated by the other way around, which is glucagon. So plasma-free fatty acids will increase. Let's continue. What is the effect of hyperglycemia? I want you to come with me. Don't stay anywhere behind. When you have hyperglycemia here, and the muscles are wasted, and the plasma-free fatty acids have increased, the increase in glucose in blood will cause glucosuria. You have glucose in urine. Yes, you have polyuria, right? You have impaired phagocytic functions. These are meaning the epidesis will be impaired, the activity of all lymphocytes and pulmononuclear cell will be affected. So we have hyperosmolar coma. When you have hyperosmolarity, you recall water will get out of cells into blood, causing hyperosmolar coma. Then we have, in case of the brain, so we have glycosylation of hemoglobin. In hyperglycemia, hemoglobin will be glycosylated to form what you call hemoglobin 1S, something like that. A1C, hemoglobin A1C. Okay? Then we shall also have late complications which come over time, like after years, due to hyperglycemia, which is prolonged or chronic. So this will include neuropathy, right? We shall have neuropathy, retinopathy. We shall have nephropathy and cataract. Cataract will affect the eyes. Nephropathy, this is will be a pathology of the nephrons. The retina and the nerves will be affected. There will be glycosylation of tissues around those four areas. So glycosuria and polyuria, they will cause weight loss because we are losing calories, so the weight reduces. This is also caused by wasting of the muscles due to increased gluconeogenesis using amino acids. More, that causes negative nitrogen balance, right? Negative nitrogen balance. due to muscle wasting. Another point to note is that due to polyuria and glucosuria, we shall have electrolyte depletion. We are losing electrolytes. Yes, due to osmotic effect of the glucose, which attracts water towards the lumen of the nephrons, and so electrolytes also come along. Then we have dehydration, loss of water from the body, but we shall have rebound hypertension. Okay. Then we have ketonuria. Ketonuria, how does it come about? It comes from the increased plasma-free fatty acids. When plasma-free fatty acids are increased due to insulin deficiency, we are getting ketogenesis in the liver. We form ketone bodies in the liver, which have two effects: ketoacidosis and ketonuria. So this one, ketoacidosis, in combination with these effects of ketonuria, we shall end up having diabetic coma. I'm explaining this. I hope you're following. Then we have increased plasma-free fatty acids. These ones will cause triglyceride synthesis, increase the tags. Hypertriglyceridemia, this one, increased the tags in blood, will cause increased plasma cholesterol, and therefore atherosclerosis or deposition of fatty plaques on the blood vessels, and you end up having myocardial infarction if the heart is affected, cerebral stroke if there is hypoxia or hypoperfusion of the brain, and gangrene, decaying or necrosis of tissues. So basically that's what occurs when there is insulin deficiency, and these are the several effects of hyperglycemia as you see here. Let's continue. So that is, I have explained a lot about that. But you can see, we can still talk more. Consequences of hyperglycemia. We said we have glycosuria, which has several consequences. We have impaired phagocytic function because hyperglycemia impairs phagocytes adherence. That is one. Diapedesis. That is two. Phagocytosis. That is three. And intracellular killing. Those four activities of the phagocytes are affected by hyperglycemia, and the diabetics are more prone to infections as compared to non-diabetics. So we have hyperosmolar effects. 4, we have glycosylation proteins. This is positive translation mechanisms, and they are non-enzymatic addition of sugar residues to amino acids or proteins. Because look at this, it is non-enzymatic, no enzyme is involved. So you should take note. Post-translational and non-enzymatic. Wow. Okay. So glycosylation. Glycosylated hemoglobin in most abundant form, the most abundant form is hemoglobin A1C. This should be a subscript 1C, which is produced by condensation of glucose with N-terminal valine of each beta chain of hemoglobin A. So hemoglobin of adult people, each beta chain has 2 beta chains per molecule. So each beta chain, its N-terminal valine will condense with glucose molecule. Okay? Normally, the concentration of this glycosylated hemoglobin is about 35% of total hemoglobin. But during sustained hyperglycemia, the concentration rises between 10 to 20% of total hemoglobin. Right, let's continue. So glycosylation of tissue proteins occurs when blood glucose levels remain elevated for years. Yes, so those will include diabetic nephropathy, diabetic retinopathy, diabetic neuropathy, and cataract, and so on, very many. Glycosuria has a lot of effects. Look at this. Glycosuria occurs if the blood glucose levels are greater than 180. That's when we start to see glucose molecules in urine. But normally, there shouldn't be glucose molecules in urine. Glucose shouldn't be lost. Should be perfectly reabsorbed within the PCT, right? Yes. So above 180 milligrams per deciliter, we are having glucose in urine. Polyuria is another effect of glycosuria. That is, you over urinate. This is due to osmotic effects of glucose within the lumen of the nephron. Osmotic effect of what of the glucose in the lumen of kidney nephrons will cause polyuria. Okay, we shall lose electrolytes. As water comes along with electrolyte, comes into the lumen of nephron tubules. It comes along with some electrolytes like sodium, potassium, and phosphate. These are lost from the body in urine. So we shall have dehydration of cells due to increased osmotic pressure of ECF and compensated dehydration. You get this point? So that increased osmotic pressure of extracellular fluid, that is blood. Yes, due to increased loss of water in the kidney nephrons. And compensated dehydration causes dehydration of cells. As water starts moving from the cells outside into the blood or ECL, extracellular fluid. Okay, let's continue. The fifth effect of glycosidia is polydipsia, where you are overeating. I mean, you need more water, overtake water due to thirst. Thirst center being activated by the cellular dehydration. Right. Increase the caloric loss. As you're losing glucose molecules, you're losing calories, so the calories are lost from the body. Polyphagia. Due to loss of calories, you overeat. Polyphagia, the stimulation of satiety center caused by deficient utilization of glucose in the hypothalamic ventromedial nuclei. So the ventromedial nuclei of hypothalamus, they are overstimulated. They have the satiety center, so they are overstimulated when there is a deficient glucose utilization by the hypothalamus cell bodies. So that causes polyphagia. The eighth is loss of body weight, right? You lose body weight, you lose body weight, you lose body weight due to, yet you're eating a lot, but you'll be losing body weight. You're losing calories. Yeah, and fat acids are being degraded. Okay. So let's talk about hypoglycemia in non-diabetics. So hypoglycemia, we're going to classify it as diabetics people and the non-diabetics. So in the diabetics, you will have postprandial hypoglycemia after eating, also known as reactive hypoglycemia. This occurs typically after meals within 4 hours after ingestion of food. That is just postprandial and is normal. Okay? Then we have, and it is caused by transient rise in insulin levels, and symptoms are short lasting. It is more common in patients who have undergone gastric resection. Yes, gastric resection. Those people, they encounter the postprandial hypoglycemia, and there's transient rise in insulin levels. Let's talk about 2, post-absorption. This is also another form of hypoglycemia in non-diabetics. The other one was postprandial. This is post-absorption, after absorbing food or fasting. Hypoglycemia usually does not occur in normal fasting patients. It is seen in patients with tumors that secrete insulin, adenomas of pancreatic islet of Langerhans, which cause hyperinsulinism. So hyperinsulinism will be responsible. In cases of hepatic failure, degradation of insulin is less, which may result in raised levels of insulin and hence hypoglycemia, which is post-absorptional hypoglycemia. Okay, let's talk about hypoglycemia in the diabetics. In diabetics, this is more common in diabetics than non-diabetics. About 4% death of insulin-dependent diabetes mellitus are said to be due to hypoglycemia. Causes of hypoglycemia in diabetics include 1. Overdose of the antidiabetic drugs, especially insulin, is comparatively common cause of hypoglycemia. Those people who are diabetics usually want to take in more insulin as they just take it. They just and they are just overdose themselves with a lot of insulin. This will cause hypoglycemia and death. Right. Other factors responsible for hypoglycemia in patients on regular anti-diabetic treatment are they they do a lot of heavy exercise, they'll end up having hypoglycemia. Mismatch between insulin administration and food habits. They usually dodge the habits of food, yeah. And alcohol intake is also another cause of hypoglycemia in patients on regular anti-diabetic treatment. That is insulin. Okay. Hypoglycemia symptoms. One, we have symptoms of the cardiovascular system. These will include palpitations, tachycardia, and cardiac arrhythmias. Those are symptoms. They will ask you, two, we have symptoms in the gastrointestinal system, which will include or tract, which will include nausea and vomiting. You know the vomiting center is activated. Yeah, you get vomiting and nausea, the urge to vomit. Skin symptoms, you'll be sweating and you have hypothermia. Yes, this temperature of the skin. We have symptoms in the central nervous system. This is a Glycopanic syndrome. Symptoms. Since metabolism of brain is depressed when glucose levels fall below 50 to 70 milligrams per deciliter. So if the glucose levels go below 50 to 70, metabolism of the brain is affected. And CNS becomes quite excitable, that is one, due to facilitation of neuronal activity by hypoglycemia, which results in two hallucinations, extreme nervousness, tremors, confusion, difficulty in concentration, coordination, convulsion this is the major symptom we see, and drowsiness. Yeah, let's continue. When blood glucose falls below 30 milligrams per deciliter, my friend, you get hypoglycemic coma. Yes, you go into coma and you are an emergent situation. So basically that is all we could talk about hypoglycemia and hyperglycemia. Please you like our videos, you subscribe for more and better videos, and